And before I get started, I just want to say how nice it is to see all of you guys again. It's hard to believe that this is our 5th year, and that this is kind of the last annual meeting that we're going to be having here. And so I'm really excited to talk a little bit about just the amazing work that you guys have done, and kind of what the coordinating center and the consortium as a whole have done over the last 5 years, and kind of some directions and where we kind of think this is going or could be going. I'm also really excited for our keynote speaker, Dr. Shweta Bansal, who's going to be talking just after me. So with that, let's dive right in. Figure out how to advance. There we go. So just as a reminder, I think most of you guys already know, but I think we probably usually have a few new faces every year. So this is a photo from our meeting last year, where we had some nice sunny weather in Ann Arbor there at ISR. Which was great. But the SBE Consortium consists of 15 UO1s. We have 16 pilot grant projects, and then also our amazing partners at NIH across 7 different institutes. So it's a really nice, large consortium made up of a lot of great people from diverse perspectives, and has been truly fun and absolute honor to be a co-PI at this coordinating center. So for those of you who do not know, we have had a few changes. You'll notice that our former amazing project manager, Megan Chenoweth, is no longer with the project. She's still with ICPSR, fortunately, doing amazing things with our metadata team. But you have Maggie and myself as co-PIs, Amy Pienta as a co-investigator, and the amazing Chloe Perry as a project. So today we're going to talk just a little bit about some of the data resources, because we're ICPSR, we can't help it. It's one of the things that we do. We're going to talk about some of the amazing research outputs that you guys have had, some new data, some new measures that are available, and some tools to look at those. Then also just some of the awards and recognitions that you all have received over the last year or so, just to recognize the recognition of the great work that you guys are doing, both within the consortium and in your other research as well. So diving right in, again, we're going to start with data resources, because that is who we are at ICPSR. So we're looking at the COVID measures archive, and just as a reminder, this is something that we created in 2023. And this was really designed as a data and a variable level metadata archive. And so as you can imagine, and many of you have experienced this firsthand, when you're working with data on health, or on COVID-19, or on public health emergencies, you often have very sensitive, identifiable data that really can't be shared appropriately or safely without the necessary safeguards. But what we can do to make those data more fair, so findable, accessible, interoperable, and reusable, so I see my librarians in the back, is that we can make the variable level metadata available. And so this is kind of building off of the social sciences variable database that ICPSR has. And this is a way where you can actually see the measures, the variables, the survey questions that are in a study if you can't necessarily see the data themselves. And there are some really nice tools in there where you can actually compare variables side by side. And we really wanted to prioritize this because, as you all can probably remember, back in 2020, 2021, you really just need data. And so there were a million surveys going out, a million studies getting started. And it was just, really urgent. And it's not really something that we could take the time to plan as well as we would like to. And so that led to some duplication, that led to some limited ability to harmonize measures. And so we hope this archive will allow people to do is take a look at what other studies have done in the past. So if you're designing a new survey, maybe you don't have to reinvent the wheel. You can borrow survey questions. You can look at what permissible values were allowed, and you can kind of help nudge people in that direction and making more harmonized data and measures. So as you can see, we started in 2023, and we've had some pretty significant growth over the last few years from there. And so as of right now, we have over 50 studies. Oh, okay, sorry, we're having a slight technical difficulty with Zoom slides, so hold that thought. All right, well, thank you for bearing with me. I'm glad I'm the one to get the bugs worked out. Okay, so going back to where we stand with the COVID measures archive, we now have over 50 studies. We actually just had one release. More than 24,000 variables and measures that you can look in, you can search. We also just recently expanded a lot of the search capabilities, making it easier to find the data and measures that you're looking for in the archive. So we're excited for you guys to try that out. Let us know what you think. And we've also been steadily expanding the number of contributors that we have, both within the consortium and then with outside the consortium, to where they have data and measures that are of interest and relevance to the consortium. Make sure I can advance here. There we go. So here's just kind of a breakdown of the types of studies that we have. So most we actually do have data for, and a lot of that is thanks to Amanda, who deposits quite a bit of data with us. But we do have some really nice metadata only studies as well that provide some really nice information. That includes one example is the COVID supplement from NHATS, National Health and Aging Trend Study. So just to kind of give you guys an idea of what's in there, but we encourage you to take a look around, let us know what you think. If you have thoughts or suggestions, we'd love to hear them. And then as you can see, we have, it's not quite half and half, about 60-40 breakdown of measures in the metadata versus the data deposits that we have there. So as far as actual usage of this, one thing that we were really excited to see is that we've seen a pretty massive increase in the number of unique downloads of data that we have in the archive. And so here we actually have our top 3 most downloaded studies or groups. And so there we have the NANA, the National Neighborhood Data Archive, is there on the left. We also have NCHAT, National Couples and Health and Time Study. Sorry, I always get the acronym off. And then the National Wellbeing Survey from Shannon Monet's group. And so as you can see, we in the green, we have the unique downloads in 2026 so far, and they're already outpacing what we saw in 2025. So we're kind of curious as to what might be driving that. We don't have any answers for you yet. We have some thoughts, but either way, we're excited to see that it's getting so much use. So with that, kind of after going through just the the overall numbers and the types of things that we have in there, we want to talk about some of the new additions that we've made to the archive and kind of some of the different areas that we've been prioritizing. So you might remember way back in 2020, in Open ICPSR, there was a kind of a collection created to allow people to deposit non-sensitive or publicly available data related to the pandemic. And so, that was a really nice resource, that was able to, make these data more widely available. But we wanted to also take some of those most popular data sets and actually, provide the curation service that we do at ICPSR to make them again more fair, make them even more high quality data, make them more usable for researchers. And so one of the first ones that we did was the CUSP data set. And this is the COVID-19 US state policy database that was created by some folks that were at Boston University at the time, namely Julia Raifman. So this is one that has now been curated and is available in our archive. After that, we also looked at and curated 2 data sets from Venter and Kohler on eviction moratoria. These are really interesting data sets. So if you have any interest in kind of eviction and the moratoria that were enacted as policy interventions during the pandemic, highly recommend you guys checking these out. It's a really interesting data set. There were 50 indicators looking at these policies and the impacts that they've had. We have a couple additional ones that are currently in progress from Simon Porcher at Paris Dauphine University. And these are all on government's responses to the pandemic. And actually one of these includes international data. So that would like to be one of the first international studies that we have in our archive. So we're really excited for that. And these have, again, been really widely used on just from Open ICPSR, which, again, is user deposited. So the documentation varies a lot. It can be somewhat inconsistent depending on how much time and effort somebody put into the deposit. And so we're really working on kind of bringing that up to, the highest standard that we have for data and for, the documentation associated with it. Some other research teams that are outside of the consortium have also recently had their data added. So this was a project from Bonham and Bacetta that they were looking at the institutional medical mistrust scale during the COVID-19 pandemic. This actually included a number of NIH authors, and we were really excited that they reached out to us to express interest in depositing with us. And so again, would really highly recommend you guys checking this out if that's of interest. And then another external researcher that we deposited some data from was Dr. Kubale, and this is on supplemental nutrition assistance programs during the COVID-19 pandemic, but then also have some data that goes back to 1987. So even if you're just interested in looking at SNAP pre-pandemic or in a totally different context, hopefully there's something there for you. Let's see. So then again, another SNAP data set that we have here. This is looking specifically at 2020 to 2023 from Zhang, Ma, and Bray. So what is next for this artifact? So obviously we're going to continue to add data, add metadata to this. I mentioned kind of some of the search functionality that we've added to make it more usable and user friendly. And this includes, adding data and metadata both from within the consortium and from outside the consortium as well. Really just trying to broaden the overall quality of the data and breadth of data that we have. We're also really interested in continuing to improve the usability and the value of the archive. And so we're working on conducting some user testing where we kind of have some different scenarios and how we think the archive could be used. And asking folks to kind of work through a scenario and then let us know what worked, what didn't, where did you hit roadblocks, did something break, all the necessary kind of quality assurance testing that we really need to do to make sure that this is meeting the kind of expectations that we have at ICPSR for it to really be a valuable resource. Okay. So now getting into some of the research outputs, including publications, presentations, and things of that sort. So here's just kind of a plot showing the consortium publications of different types since the Coordinating Center and the consortium started back in 2021. And so you can see there's been quite a bit of productivity in a number of ways. And so that blue bar are publications. And so I believe we are, since the last meeting, there have been 30 publications in peer-reviewed journals. We've also had 3 from pilot grants and pilot grantees where they've published as well. We've had a number of research briefs or issue briefs, as we've also been calling them, some preprints. And they bring, I believe, the total number of publications from UO1 projects in the Coordinating Center to over 100. So, for 5 years, really productive, amazing work that you guys have been doing. We've been lucky to be a part of. So, as far as how the Coordinating Center, works with these publications or works with you to kind of help disseminate these, a lot of you guys have already worked with us a number of times. And so kind of already know how this works. But for those of you that haven't yet, there is still time. And some of the things that we do is just providing, shining a spotlight on the work that you're doing. So announcing, the publications or presentations that you're doing, sharing the key results that you're doing at whether it's on our social media, on our website, at different meetings that ICPSR holds or attends. But also, and I'll talk about this in just a second, some of the issue briefs that we've been working with our amazing partners at CHART. Whom we have a representative, John Rodriguez, right there. And they do an amazing job of really kind of distilling the key findings that you guys have into more approachable language for non-technical audiences. So we're thinking about policymakers, we're thinking about the general public, we're thinking about folks who don't spend their days thinking about models or research or survey questions. The other folks that we still want to reach with these important findings. So as I mentioned, we've been continuing to build out these issue groups, and so these are kind of akin to what the folks at Syracuse have been doing for a long time. just kind of providing, research findings in, a form that is more digestible to non-academics, essentially, to broaden our reach, to make sure that they're reaching the necessary audiences. So these are 1 to 2 page summaries of published research, and they're really, again, aimed at non-technical or non-academic audiences. So far, we've been kind of, starting slowly, but we have, 3 that have been released so far, another 3 are in progress, and we have plans for several more as well. So if you do have research that you would want to have featured in this, please reach out. We will also reach out to you guys, as many of you guys have learned. We're not shy about sending you guys emails. And, again, the nice thing about this is that if you reach out, even as something is under review, we can work with you to, develop these briefs so that they can come out at the same time. So, we have complete control over that. We can, respect embargoes. And it's all about, increasing the reach, increasing the impact of the great research that you guys are doing. And again, this would not be possible without our amazing partners at CHART or the Center for Health and Research Transformation. They are also the folks who put together the really nice annual report after each of these meetings every year. So just kind of an overview of who we've featured so far. Our first one was from the NANDA team, Grace Knopper and Philippa Clark. If you've not looked at that, it's a really interesting one looking at differences between 2 vulnerability indices and some advice on how to kind of handle that if that's something you feature in your research. We've had other briefs from Pei Hung, Xiaoming Li, John Xu, Pei Yin again, and Caroline Rudisil, who was one of our great pilot grantees, did some really interesting work on mistrust of the healthcare system. And most recently, Rita Hamad, who was the PI who led the county COVID policy data. So another kind of service that we've continued is, consulting kind of technical support in a number of areas. So I know many of you have really taken advantage of particularly the statistical methods, the survey research expertise of our other amazing co-investigators, Dr. Brady West and James Wagner. There's also, I've talked to a number of you guys about epidemiology, infectious diseases, and then of course, being ICPSR, we are always happy to talk about data and metadata, archiving and sharing data. So again, those services are things that we have continued and expanded and are happy to field any questions related to those going forward. As part of that consulting, we also have been really trying to expand the kind of methodological webinars that we provide. You're really taking advantage of James and Brady's really amazing expertise in a wide range of areas. And so over the last year, we had a couple webinars that were really well received from them. So Brady talked about improvements to mass imputation into certain scenarios, and James talked a bit about his experience in incentive experiments for recruiting clinicians to participate in research studies. And so, I think those were really interesting webinars. I know a lot of you guys attended at the time. We also do have those videos available, or recordings of those presentations available on our YouTube page. Again, as we're kind of looking after a couple of years, we want to talk about how well received they've been. And I think this was 2 years ago that Brady presented on using weights when analyzing survey data. And that was one of the most popular webinars that we gave. So far, it has had over 8,000 views on YouTube since then, which, for statistics is, I would say, a fair amount. We also, kind of the next closest to those, are not quite as popular, but still are getting some work. And that is Introduction to Common Data Elements, which is certainly something you've heard me talk about a lot. So the talk that James McNally, who previously was a co-investigator and is now back working with NIA, gave at the very beginning of the project. And then a presentation on the U.S. COVID-19 County Policy Database from Dr. Rita Kubale. So again, we are in the process of updating. I know a lot of you guys have been dealing with the new accessibility requirements, and so we're prioritizing, some of these as well to make sure that those are up to snuff, for that, and that they can remain available and accessible for folks to continue viewing well into the future. So as far as kind of, capturing, what all we've learned over the last 5 years, we do have some kind of ongoing projects with this. that I know we've talked about kind of in passing over the last year, but those are still continuing and making progress. And that is, really trying to synthesize across all 15 projects and what the Coordinating Center has done, what are the key findings, what are the key takeaways that we have. And so, we do have a draft of the white paper, and it got a little bit tabled for, some more administrative reasons, but it will be coming back and you guys will be hearing for us to make sure that we're accurately representing, what you guys have done. And so, again, you guys would have a chance to weigh in on that and provide feedback, as well as being, frankly, as authors on that white paper. We are also currently working on a toolkit of resources. So, again, this is kind of another way of making those findings and, key pieces of information more readily accessible for, the next public health emergency, whether it's a pandemic, whether it is some kind of natural disaster. Unfortunately, as an infectious disease epidemiologist, I can say, I don't know what it is, but we will have something. So, on that, should we know? I want to talk a little bit about, and I know I'm running a little on time, so I'll kind of breeze through this, but our pilot grant, program is one of my favorite parts of getting to be a co-PI of the Coordinating Center. I get to read a lot of really interesting proposals and work with, particularly a lot of early career folks like myself that are doing just really exciting things. And so over the course of 5 years, we funded 16 pilot grants. We have 7 presentations for pilot grantees this year that we're really excited for you guys to see. We have another 4 that are concluding their work this year. We've had 3 publications so far. And that may sound like a small number, but these are designed to fund potentially high risk research as well. And so the fact that we're seeing that already is really encouraging as well. And we've also seen pilot grants being used for other things that maybe don't directly lead to publications themselves, but allow for the collection of additional data or measures, things like that. We have already featured one in an issue brief, and we have another that is also sharing data in the archive. So as I mentioned, we have 4 teams presenting during the annual meeting. We have, and you'll see them there. We have Sharifa Nasreen and Victor Polanco. Christopher Monk, who is not presenting, but the presenting author is Savannah Michaud, Lane Hill, and Guang Wang. Then we have 3 teams that are also going to be presenting at our May 28th consortium meeting, which will be virtual. So hope you guys can make it for that as well. So the other nice thing that we wanted to feature is that, again, the amazing work that you guys are doing has often been recognized, not just by us as well. And so we want to recognize some of the outside awards that some U01 participants have had over the last year. And so we had Grace Knopper, who received Research Faculty Recognition Award from the University of Michigan Office of the Vice President for Research in June 2025, which is a very big award for research faculty at the University of Michigan, very well deserved. We had Pei-Yin Hung, who was named a Fierce 50 Health Equity Scholar honoree in September 2025. Shannon Monnet was elected president of the Rural Sociological Society for a 3-year term, and also received the Rural Sociological Society's Frederick Buttle Award for Scholarly Achievement for her book Rural and Small Town America that she co-authored with Tim Slack. And then also Jennifer Carras-Montes, who was elected president of the Interdisciplinary Association for Population Health Science. And then I actually found out about a late addition to this that we didn't have time to add to the slides. But Konstantin Kunze was recently offered an assistant professor job at Baylor University. So I want to give you a shout out. Congratulations for that. Yeah. But again, just kind of shows the amazing work that you guys are doing. And it's so nice for us to see that you guys are getting the recognition that you've all done. And so, with that, I want to talk a little bit about, close and kind of how we're going to be sharing the findings and some other opportunities to engage with the Coordinating Center over the coming weeks and months. So again, we will be working with CHART to develop an annual report. And so stay tuned for emails from us to make sure that we are, again, accurately representing your findings and prioritizing those. That will also be used to update, profiles on the website and really just kind of highlight the progress that you guys have been making in the last year. We will be continuing our consortium meetings through the end of the project. And then we will also hopefully see many of you guys at the Population Association of America meeting here in just a couple weeks in St. Louis. With that, I think I might have about 30 seconds or a minute for a question. So any questions on anything that we have? You guys are firing these students. I will just take that as a mark that I just explained everything extremely clearly. There's no uncertainty.